This is a free preview of the full hour-long masterclass available exclusively on the Physiotutors app. Check the link in the description.
TMJ pain. Is it all in the head? An introduction to why TMJ pain may sometimes persist. Hello, I'm Baram Jam. I'm in Toronto, Canada, and it's my honor to be a presenter with Physiotutors. Just doing a little bit about me, I've been a physiotherapist for 33 years. I practiced at Athletes Care. I practice currently at Athletes Care in Toronto, York University, and I'm also part of the organizers that started the pediatric chronic pain program at Sick Kids Hospital in Toronto also. So let's begin. Lesson 1, Introduction to Temporomandibular Disorders, or TMDs. Now you may notice that with every lesson that I'll be wearing a different hat. Lesson 1, let's first define TMDs. Now this is a mouthful. TMDs encompass a group of conditions characterized by anatomical and/or functional abnormalities affecting the muscular and/or articular components of the temporomandibular joint, or we'll call TMJ. The focus of this presentation will be on the ones that don't respond to various medical interventions. And what do you look for in a man? A high threshold for pain. Now, this brings me to the topic when people have to guess, who do you think has a higher pain threshold, men or women? The answer is, based on studies, it's the same. It's funny though, most women will say women and most men will say women also. Welcome back. Lesson 2, the possible risk factors for developing TMDs. There is a probable association between depression and TMD in adults. But it must be said, the vast majority of people with depression never develop TMJ problems. Risk factors for developing TMD, hypothesis number 7, hereditary. Is there research to support this? Perhaps. Once again, research is conflicting in that area. This systematic review shows that evidence for the role of heritability in the development of TMD pain is accumulating, meaning there's some evidence, while another study concludes currently no evidence of associated genetic variants which can determine the development of TMD. It's not like we can predict through a gene test and say, oh, you're going to develop TMJ problems. Lesson 5, recognizing primary pain. How else can one identify primary TMJ or facial pain? They've experienced several failed past treatments. They've tried chiropractic, osteopathy, physiotherapy, acupuncturists, mouth guards, dental, they've seen dentists, and they've had massage therapy, releasing soft tissues, and physio exercises. Nothing's worked. And medications, of course. Dental work, physio, osteopathy, chiropractic, acupuncture, appliances, meds plus injections, perhaps even surgery. So why are so many patients unresponsive to all these modern biomedical interventions? Modern medicine. Well, Bob, it looks like a paper cut. But just to be sure, let's do lots of tests. And this is pretty much a reality. People so too often get needless imaging done, which does nothing to help the patient other than add more to the catastrophization and the feeling that they're broken, which further promotes the experience of chronic pain. Next, I will discuss evaluating primary pain. I look forward to seeing you at the next lesson and you seeing what my next hat surprises. See you. Welcome back. In case you're wondering why I'm wearing the red nose, as I said before, I work with a pediatric population, with a pediatric chronic pain program that I run. And obviously, I want to make things less serious for the children, and I want to make things less serious for the adults too who are experiencing pain. So, just to make you smile. But I'll leave my hat on, not my nose. The CSI is a validated outcome measure for evaluating the severity of central sensitization and monitoring progress. And it's available on Physiotutors' website. The CSI is indicated not just for those with TMJ pain, but for those who also report on multiple or physical issues, significant functional limitations, and psychosocial distresses. So I don't give in to every patient. In fact, the vast majority of people, I don't have them complete the CSI. But people I think I need a score because it's an outcome measure. Well, I'll evaluate them 6 weeks or 3 months later to see if they've improved. The CSI is freely available on paintruth.org website, but also on the Physiotutors website, under the questionnaires and on physiotutors.com. Sample pain education strategy. Look at the squares A and B. Which square is darker shade of gray, A or B? Your brain will inevitably perceive square A to be darker than square B, although they're exactly the same shade of gray, as you can see their images on the left-hand side top. What if we covered everything up? As you can clearly see, square A and B are the same shade of gray when viewed out of the context of the checkered board. Your brain has the knowledge of what a checkerboard looks like and has learned to predict alternate black and white patterns. Since square A is positioned in between two white squares, look at it there, then obviously square A must be darker in color. Since square B is positioned in between two darker color squares, well, then obviously square B must be lighter in color. Another assumption your brain makes is that it uses your past knowledge of lights and shadows. Without your conscious awareness, you notice that the green cylinder is casting a shadow on square B, but it's not casting a shadow on square A. Therefore, your brain instantly makes the decision that square B must be lighter, as that's supposedly a shadow on it. And shadows obviously make things appear darker than they actually are. As you can clearly see, square A and B are the same shade of gray when viewed out of the context of the checkered board and no shadow from the green cylinder. I've certainly cut and pasted the image on the outside. Next, I'll discuss 3 real TMJ patients as sample cases as our final lesson comes along. When it comes to TMDs, based on the best available evidence, focus needs to shift away from the traditional pure biomedical model and more towards the biopsychosocial model. That's basically the entire point of this presentation. The complete physical assessment and management strategies for secondary and primary TMJ pains are well beyond the scope of this short presentation. For more information on addressing primary pain, you may visit thepaintruth.org, where you and your patients may view all the freely available educational contents, and Physiotutors also has excellent courses on central sensitization management strategies. Thank you. I'm afraid that if I get better, I will no longer be able to see my physiotherapist. Sometimes that may be the case. Thank you for joining me. Have a wonderful rest of your day.